Hi, I'm Fran Hooley, lecturer in Technology Enhanced Learning at the University of Manchester, and I've got with me today Manoj Mistry, who has been a public contributor for 10 years with the university and is a family carer. We've just got a bit of a chat today around his contribution to learning health systems and a paper that he was involved in, which is in the link below. I'd like to introduce you. So, hi Manoj, nice to see you.
Hi, Fran. How are you today?
Fine, thank you. Fine. So you were a co-author on the paper, Participatory Co-Design of Patient Involvement in a Learning Health System. How can data-driven care be patient-driven care? So how did you find that? How was that experience?
Well, Fran, I've known Dr. Sarah Knowles, who's a research fellow at the university, for many years. I'd worked with her on various projects previously, and she's a great proponent of patient-public involvement in health research. So when this opportunity was advertised, I applied with great interest. I got selected, and she chose 6 established public contributors who'd been involved in various other research projects at the University of Manchester. So I was one of 6 that was selected, and then we contributed to this research project over a period of about 18 months. It was Dr. Sarah Knowles' postdoctoral fellowship, and her topic was learning health systems. So in all my involvement with the University of Manchester, which now stems back to almost 11 years, this example stands out as one of my top 3 examples of genuine collaboration between a university academic, clinician, and member of the public. So what Sarah did in the first place, she came to us, group of 6, and we had our meetings on campus in the business school building. And she came to us with preconceived ideas of what a learning health system is, or what it contains, or what the key components are, and how members of the public, patients and carers can contribute to the development and evolution of a learning health system. So we all listened attentively. We're all experienced, genuine public contributors, but we weren't going to just sit back as passive passengers. We acted as critical friends. So we questioned every idea, every thought that Sarah had written on her slides, in her presentation slides, and we questioned everything. We were critical where we had to, we were positive when we needed to be. But basically what happened was Sarah went back and she redrafted everything. So she revised all her views and opinions. So it was a constant learning process both for us and for Sarah, the researcher. So actually, the research project itself was a learning health system in itself, because she was constantly learning and adapting her ideas and formulation of what a learning health system actually is or should be. And with Sarah being a great proponent of patient-public involvement in health research, let alone in the use of health data, she had us as patient care representatives at the core of a learning health system. So what I would say in summary, Fran, would be that this example was an outstanding example of genuine collaboration and cooperation between a university academic stroke researcher, member of the public, patient carer.
That's great. Thank you. So based on that then, in your opinion, what do you think a successful learning health system would look like? And what should the clinical staff and the patient reps be aware of in order to achieve this?
Interesting question. What I would say, some of the key components, or should I use the word ingredient? Some of the key components would be a learning health system has to be one that listens. It's got to be one that listens to the users of the system. So in this setting, in a health setting, a learning health system has got to be one that listens to patients, carers, family members. So it captures their feedback, but then it incorporates that feedback It's constantly learning, constantly adapting, constantly evolving to adapt and change the health system. So it's learning based on the feedback it receives from the people, the very people that actually use the system. So to me, it's about seeking feedback, capturing that feedback, making improvements and incorporating improvement based on that feedback. But this has got to be a constantly evolving process, an adapting process.
Mm-hmm.
So that's what, to me, a learning health system should be.
Mm-hmm.
So in terms of what staff, clinical staff should be aware of, that need to always listen, have the willingness to record feedback, the willingness to share that feedback, the willingness to incorporate that feedback to ensure constant improvements in health systems.
Mm-hmm. That's great. So, as you've sort of touched on, a learning health system ideally involves collecting data and learning from it in order to make decisions that obviously ultimately lead to improvements in care. Patients are most likely to be involved at the data collection stage. What are the issues that matter to you related to those issues around data collection from patients?
Again, a very important question, an interesting question. Is the data accurately captured and recorded? I think that has got to be done correctly in the first place. So the data recorded and captured accurately. Mm-hmm. Is it in the right format? Who has access to this data? Who's going to use this data and for what purpose? How secure will this data be kept in whichever environment is being kept? Is it a trusted research environment, i.e. the data is secure and sufficient measures are put in place so that third parties can only have access if they prove certain verification checks, because we don't want all and sundry to have access to our personal health data. Another issue would be how effectively and within a timely manner the data gets transmitted from primary care to secondary care to tertiary care and vice versa, to make sure that whichever clinician or academic or healthcare professional is looking at the data, they have accurate, up-to-date and complete data as and when it's needed. So there were some of the